This is the Real Health Podcast brought to you by Riordan Clinic. Our mission is to bring you the latest information and top experts in functional and integrative medicine to help you make informed decisions on your path to real health.
Well, welcome everyone. It's Dr. Ron Hunninghake from the Real Health Podcast again, and it's my real pleasure today to have Dr. Charles Meakin, who is very happy to be referred to as Dr. Chuck. So Dr. Ron and Dr. Chuck are going to be on the program today. Dr. Chuck, thanks so much for coming on and speaking with us today.
I'm honored to be here, and thanks to Amber for getting this set up pretty quickly, and my partner Addie from Heal Navigators. We worked with Heal Navigators for sort of finding this and this time slot, and I'm honored to be here.
Well, you know, this program is about real health, and you have, in your background, you've been in oncology. You're a metabolic coach. This concept of metabolic health seems to be at the core of what you do at this point in your career. What is that, and how did you arrive at this point?
So, like all of us in our career, you know, the path isn't that clear. As a kid, I was always interested in mind versus body, and studied the martial arts and studied Eastern religions and Eastern philosophies, you know, through high school and college. Ultimately went to med school, was very charged to help out in the caring profession, and therefore chose oncology because I thought that best studied the relationship of the body, the mind, and the spirit in a difficult situation. I worked in a way where I always tried to bring the easiest, you know, most available, you know, therapies to people using the best of standard of care. I was in a big group with some of the best and the brightest. And secondly, but also the lifestyle issues that I felt that were, you know, just so important. You know, it never made sense to me to see a patient that had terrible lifestyle issues, you know, sleep, diet, exercise, you know, emotions, you know, that I call mission alignment, sort of a purpose in life. Yet we were only dealing with sort of the details of some sort of chemotherapy or radiation treatment. And so as that wound through, I ultimately launched into sort of this second career, focusing on mainly metabolic issues, using repurposed drugs to enhance the outcome with cancer care and also to prevent chronic disease. Metabolic care would be described as sort of, you know, how to best improve or optimize the internal utilization of our nutrient, energy, oxygen substrates to have efficient metabolism and therefore help our body to work most efficiently. And sort of like in the work you do, this involves a lot of micronutrients, a lot of good lifestyle modifications. And I try to bring a platform to people that they can study that rather quickly in a virtual format at low cost, and then have options to sort of modify, you know, hitting the big priorities first as they sort of go through their health path, generally with cancer, but sometimes with other things.
Yeah, the whole cancer paradigm has been so tumor-centric, like focusing on the cancer as the tumor without really looking at how that person's metabolic health or lack of it set the stage for that tumor to find a place to grow. In other words, if a person has a weak immune system, or if they are inflamed, or if their blood sugar is way out of whack, that's setting a ground stage, a terrain stage that allows for cancer cells to grow and to thrive. So without dealing with the metabolic part of the human being, the outcome is not going to be as good in cancer care. At least that's been my experience.
Exactly. I always say that, you know, we need to kind of put out the fire, but also correct the terrain. And, you know, everybody in the cancer world has read the hallmarks of cancer by Hanahan and Weinstein.
Right.
And in 2019, they added two more hallmarks that are more metabolic in their mindset. So there's sort of this debate, and my partner at Meakin Metabolic Care, Travis Christofferson, he's an author and wrote the book.
I love his book. I love his book. He's a great author.
Yeah, and he's a wonderful writer. He can take complex things and simplify them. And so he was able to communicate the message that, we're missing something here. There's the somatic mutation theory of cancer, where you look at a gene mutation, and then you, once again, as you said so well, look at just the tumor, and you pound away at, maybe mutations or, over proliferation flaws in a certain genome. And many of those mutations are downstream mutations from lack of regulation, whereas Travis and many others have sort of targeted more. Let's look at the metabolic theory. The somatic mutation theory is not unimportant, but the metabolic theory is also important. And that involves, once again, the environment of the body, how metabolism works, and how to optimize that to kind of get the immune system and the drivers of proliferation back into control. And so that's sort of what we do to help people improve the outcome or optimize the outcome with their cancer therapies. And we have a virtual platform. I cover 45 states, keeping up with those licenses. I know Riordan Clinic covers 50 states and 50 countries, but I got my 45 licenses, and we have pharmacies that cover all the U.S. And then for outside the U.S., I just do sort of coaching calls more than MD calls.
We've been fascinated with how many cancer patients, when you start digging down into the causes of their cancer, there's oftentimes a traumatic event or a series of traumas that were kind of an initiating, didn't necessarily start the cancer, but it had a kind of domino effect on their whole metabolism. And to me, what's interesting about that is that we're now finding out that the brain is very susceptible to traumas, not just concussions, but life traumas and stress and those kinds of things. And so it's interesting to see how the mind-body connection is now starting to be understood as a legitimate scientific area of exploration, to where we need to help our patients understand themselves and to take action in the direction of healing some of these traumas and helping their brain-body connection to work better together. So, and that does involve a lot of coaching and one-on-one therapy. So do you get into that much these days?
Yeah, I do. Thank you, Dr. Ron. On our onboarding form, and I'm trying to walk the rope between making it, easy and available, cheap, people pay out of pocket, but also high touch, high effective. People do an onboarding form, and we ask about the stress in their life. We ask about their social engagement. We ask about their mission alignment, and mission alignment is sort of the term that describes what you do every day. How does it match up with your long-term life goals? Some of those goals might be altruistic, or how to leave a footprint or a fingerprint, when we're gone. And then social engagement, especially with us men, we collapse into solitude, and we are pack animals. We're used to sleeping in caves with our tribe, more or less. And it's important that we lock arms with our loved ones and work through this together. And unfortunately, so often in our standard of care, programs, and I hear this every day as I see people, I went to that, big, cancer center, and they told me I got 3 or 6 or 9 months to live. And, I know they need to give consent and give people sort of straight beef on what the risks are. but there's never a good reason to destroy hope. And, the nocebo effect is just as powerful as the placebo effect in a positive way. So you can walk people into a deterioration if you allow your language to do that. So, I try to spread the word that is very important. In fact, it is probably as important as a lot of the hardcore standard of care stuff we do, in my mind.
Yeah. So one of the books I recommend all of my cancer patients to read is AntiCancer Living. Is that by Dr. Cowan? I forget what his last name is, but he's the head of the integrative department there at MD Anderson. And he basically says that epigenetically speaking, in other words, the lifestyle choices that we make in our lives have at least 50%, probably more than 50%, to do with the outcome of the therapy in a cancer situation. Mm-hmm. So, and he lists as his number one factor is connectivity. So just what you were talking about, if people feel disconnected, that's not a good prognosis for their outcome. And so helping people get connected with their tribe, but also with themselves, because a lot of people are, especially in the world that we're living in, that they're trying to find connections. They're trying to take better care of themselves, but they don't know where to turn. And so here at the Riordan Clinic, we've always emphasized the lifestyle component as being an incredibly important part of effective cancer therapy.
Yeah. I've been on a integrative oncology program with him, and the original book AntiCancer by Paul Schreiber.
Yes.
Yeah, and he talked about the terrain, and then of course the book about people who crack the code and figure out survivorship. Kelly.
Radical Remission.
She also studied
Kelly
the
Turner. Kelly Turner.
Big part of it, of the 9. I think there was 9 key features with all these people who had surprising survival from difficult situations, and 5 of the 9 were emotional, spiritual.
Yes.
So it goes to show you the importance of that. I always ask patients, well, why do you want to fight this cancer? And a lot of times, it comes out like, well, gee, of course, I don't want to die, or I don't want to be in pain, or I don't want to leave my wife and leave my husband. And then I said, well, why do you not want to leave them? It's peeling back the onion. Mm-hmm. And ultimately they get to the core and they figure out why they want to be here. And that's where I get them to try to focus. I said, you need to put that on your mirror. And whether it's, teaching your grandchildren, lessons in courage or whatever that is, put that on your mirror and then look at that every day. And then the hard things of being a cancer patient or a chronic disease patient become easy. You can run through a gauntlet if you have a good purpose in mind. And so that sort of lights the fire frequently. Then you talk about social engagement. You talk about, the importance of a spiritual connection. You talk about, as you well know, about, you can't do this alone, except help. But also encourage people to start, even in the difficult woes of dealing with something difficult, you want to reach out and help other people. And that's going to immediately cast you as someone that's going to do better no matter what you're in. I always go back to the book by Luis Gonzalez, Deep Survival. And the biggest predictor of getting through a shipwreck or a plane wreck or a flood was if someone had to help, like an older person, a child, somebody was injured, would almost guarantee their success. And they kind of get out of themselves and reach deep. And so, we try to emphasize those things. We also look at more mechanical things like, what your HOMO-IR is, or your insulin resistance driver. Cancer cells have IGF and insulin receptors on them, and we want to dial that down through diet, exercise, repurposed drugs, intermittent fasting, those tools. We look at high-sensitive CRP. We have a battery of 12 simple lab that are relatively cheap to get, we get them at Quest through sort of they pay us and then we extend the discount significantly to them. And it looks at some of the core things, not as in depth as I'm sure you do with your micronutrient levels and vitamin levels and food sensitivity stuff. We do that if we need to, but we get the core stuff, like a basic methylation screen, cysteine, thyroid screen, magnesium, LDH, uric acid to look at like fructose metabolism and things like that, all the basic chemistries. And then that goes into a calculator called the MOP calculator, Metabolic Optimization Protocol Calculator. And that creates a score. We also do a pheno age, the age clock devised by Morgan Levine. And we put those in, and it's an open domain tool I just released, I think in 2021 maybe. And we calculate their biologic age to compare with their chronologic age or real birthday age. And that gives us another metric to follow. And then we suggest kind of the 5 biggest variances. And it might be 3 of them are, non-laboratory driven. They're more like you need to set up play dates with your buddies, or you need to, start the day with, you got to get rid of the trash. You got to rehydrate in a vigorous way in the morning, or it might be you need to really step up with resistance training. And everybody we see and send pharmaceuticals to or supplements to, we send a really durable stretchy band that I give them like a 6 basic, around the body, the 6 biggies, bicep, tricep, chest, back, squat, deadlift. So they hit those muscles in a gentle way and work up 3 times a week. The work on muscle maintenance is amazing.
Incredibly important
to impact all chronic disease, dementia. The myokines, the cell signaling that come from that are very powerful, and it's so frequently undone and overlooked.
Right. We one of my favorite tests to do, just to narrow it down to one test, is a fasting insulin. I've been reading Ben Bickman's Why We Get Sick book, and if people would just do that test and let that be a kind of wake up call, it can be a big pat on the back. If you're less than 4 or 5 on your fasting insulin, you're doing a great job. But if it's starting to climb up, you're in danger territory. And so this is where I try to invoke Dr. Riordan's great term, co-learning, where I want to get into a relationship with the patient where we can learn more about what is it that's unique in your life that allows you to make better choices in favor of better health. I mean, certainly everything in life is a choice, but how do we know when we're moving in the right direction? And so this is where in functional medicine, by measuring things, it gives you standards that you can then judge how well you're doing that particular area, whether it's a certain vitamin D level or the insulin resistance marker.
Yeah.
Any of these things give people a starting point. Then you say, okay, now with that, go out and here's some things that you can do. And then in 2 or 3 months, come back and let's remeasure and see if you've made any progress. And people will follow, they'll change their behavior more to a fact than they will if you sit there and pound them over the head. If they know that fact, that insulin resistance number is scary, that's going to get them to adjust their sugar intake and get their exercise going and those kinds of things.
Yeah. I like the work of Ben Bickman. He was on our consulting board at the company I used to work for that ultimately merged, Care Oncology. We do a HOMO-IR, which is just your fasting glucose. I think it's calculated with a division by 405 by your fasting insulin. And the data on that is very powerful. I mean, you will see insulin resistance 5 to 15 years before your hemoglobin A1C pops. I had a gal just recently, looks fit as a fiddle, mid 30s. She had a fasting insulin of like mid 80s, but she had a fasting glucose in the mid 80s, but she needed an insulin level of, I think it was 12, keep it there. So, she's working too hard to keep that insulin down, and she's on the path. She's going to correct, of course, but you can look under the hood pretty easily without spending a lot of money. And we all know that cancer cells, have IGF and insulin receptors on them. Insulin tells the body to do three things. One is tell cells to multiply because we're in the fed state. We got food around or substrate around, and you don't want your cancer cells seeing that all day long. Of course, it also does other things. It turns off fat burning, and it tells the body to store energy because we're in the fed state. So, that's what, as you say so well in some of your programs, we in America are not fit, and over half the population has metabolic disease, and it's because of the cycling we see all day long of our insulin growth factor, and in the change in our lifestyles. So I'm hoping that we're gradually spreading the word. I see windows and opportunities that make me excited. We, on some of these integrative oncology working group talks, we have people like some of the teams from MD Anderson, Sloan Kettering, recent talk by the breast expert at Sloan Kettering. And what I used to notice was, we treat women with breast cancer, and virtually good many of them, at least where I was in North Carolina, would become metabolically unfit after treatment. They would gain a lot of weight. They became inactive. They had itises all over the body, it. And I said, what are we doing? Of course, finding people with Decadron as an anti-nausea agent. We're giving them stuff that makes their joints sore and disrupts their sleep. And now they've shown that at Sloan Kettering, where they have the resources, that those women that became insulin resistant or partially insulin resistance through treatment have a much higher rate of recurrence. And that doesn't surprise any of us, I'm sure. But now they're looking at ways to sort of best manage this up front, like the stuff you and I do every day, I believe,
Yeah.
to prevent that. While still people get standard of care. So I see some of the conversation, slowly coming our way.
And it's happening in several different fields, like even in mental health. A lot of people who get the various medications for schizophrenia or for depression or for bipolar, the medicines themselves are setting them up to be metabolically disabled. So we're having to rethink, how do we deal with these chronic illnesses besides just using pharmacology or chemotherapy? Not to say that these shouldn't be used, but I think there's an integrative role for the metabolic syndrome to be a kind of foundation on which we can help people make overall better choices and thereby reduce their risks for this whole plethora, Alzheimer's, the mental health diseases, the autoimmune diseases, and just the list goes on and on.
Yeah.
They're all related to the metabolic syndrome.
Bingo. And, I wish I could pull the author out of but one of the original studies took place in England, where they simply gave one half of like a giant prison population a daily multiple vitamin, and the other half they gave placebo. And what they saw was the group that got the daily multiple vitamin, which most of us wouldn't think would be that impactful, they had a great reduction in their, in their violent behavior, in their misbehavior, and, getting further lockups. They had a much improvement in their overall behavior. And then I go to the work of, I think it was Dr. William Wall, with the book Nutrient Power. He is an engineer and worked at a local hospital in Chicago and started seeing these patterns and just had this lifelong learning mindset. He started studying people's diets and their nutrients levels. He found that when he replaced those, many of these people normalized. So my mantra is, don't really make the diagnosis of a mental health condition until you optimize people's nutrition health, metabolic health, remove some of the stressors, because I think all of us could be mentally unstable with you name it if we were put in the right circumstances of stress, poor diet, circadian rhythm disruption. And so I think, unfortunately, we first treat with meds generally, and then people are labeled for life instead of, supporting them metabolically and lifestyle wise, and then see how they behave. But I think the work's coming around. Some exciting work at Stanford and some of the other recent doctor from Harvard who's written on this.
Dr. Christopher Palmer.
Palmer, yes.
Yeah, I just finished his book on brain energy, and it's all about this psychiatry has missed out on a fundamental foundation of mental illness, namely dysmetabolic syndrome. That you could just call it that. And so I think the roads now are all starting to converge towards this metabolic syndrome as a foundation in chronic illness. And the value of that is people can take control of their lives and make better choices, and thereby heal and maybe prevent better than what they ever thought they could.
Yeah, I agree. I love your sort of organized co-sharing of decision-making there at Riordan Clinic. My tagline, after I finished big hospital work, I started a blog or a charity website to coach people. And it was always stay strong and curious and be your own best doctor.
There you go.
And that sort of turns back the responsibility to show up and follow through if you really want to tackle this.
Yeah.
And it's a little scary for some, but most people would rather have some toggle switch of control to help themselves.
Dr. Chuck, this has been wonderful. I think we could go on for another couple hours here, but I think we have to wrap it up. I'm sorry that we couldn't go more, and maybe we can get you back on again and we'll go into greater depths, because I think this metabolic syndrome is going to be a place where we can circle the wagons and get all the various components of medicine working together with a commonality that we haven't had before.
Yeah. And as you said, they're converging. I believe that, like you do, whether it's mental health or metabolic health, cerebral vascular, cardio, cancer, it all comes down to mitochondrial function.
That's it.
And Robert Lustig, metabolic researcher at UCSF, he pointed out there are now 14 cancers that are on the rise that are all metabolically driven. They're associated more commonly with the risk factor of metabolic dishealth or obesity, metabolic syndrome, however you want to call it. And so, that's our call to arms, to really make people aware of that. And good news is you got easy tools to fix it. But I also want to, shout out for your clinic. I mean, I know that you guys, have been doing a lot of hard work, for 30 to 40 years. There are probably times where, you were sitting alone there at the medical conferences with all their doctors, sort of pointing out, that's not quite standard of care and stuff. But it's nice to meet a teammate that, I think our team is getting a little bigger.
I think so too.
That brings me excitement to go to work every day.
You bet. Dr. Riordan had a vision, and he felt like he was a bit of a loner, but gradually more and more people are seeing that this metabolic foundation to health we've got to build that back if we're ever going to really restore our population to the health levels that they really need and deserve. So, but thank you very much for being on our program, and I wish you all the best, and we'll try to get you back on again here in the near future.
Thank you, Dr. Ron, and thank you, Amber. Appreciate it.
Thank you for listening to the Real Health Podcast. If you enjoyed this episode, be sure to subscribe and leave us a review. You can also find all of the episodes and show notes over at realhealthpodcast.org. Also, be sure to visit riordanclinic.org, where you will find hundreds of videos and articles to help you create your own version of real health.